basic concepts of health education and health promotion. There are two words. One is health education, one is health promotions. Perhaps everybody heard these two terminology, health education and health promotion. These are the basics for promoting health, rather I should say improvement of health and well-being of the people. There is two separate concepts. One is health, one is disease. When we feel uneasy, then it's called disease. When there is dysfunctions of any parts of the body, then we feel discomfort, this is called disease. But health is something else. Perhaps all of you know about the concept of health. Okay. The WHO definitions of health, the complete state of physical, mental, social, and now spiritual well-being, and not merely the absence of disease or infirmity. So our objective is to promote health, improve health. Okay. So in order to improve health, we have to emphasize upon these two concepts. One is health educations and one is health promotions. So within health promotions, health education is there. Usually there are two or three components of health promotions: health educations, advocacy, these two main, and mediate is there. So health promotion consists of health education plus something else. So first I will try to discuss with you, rather I will try to change my feelings, opinions and deliberations with you. Hope you will interact with me whenever necessary. Feel free and ask questions for clarifications. Though the terminology is not new, but the concept is perhaps the new with you. So before we start, we have set few learning objectives. In these sessions, learning objective is, at the end of these sessions, you will be able to, number one, to know exactly what is health education. Next, to know what are the principles of health education, what are the methods of health education, what are the materials of health education, and what are the media of health education. And next is to know about the concepts of health promotions, principles of health promotions, action areas of health promotions, and how to prepare an action plan to promote health. So these are the learning objectives. Now, little bit history you should know. The word is very common, health education, but you should know a little bit history of health education. In 1792, the concept of health education was developed long back, but it was extensively used in 1980s. What for? As a cost-effective intervention method for promoting health by changing unhealthy health behavior. Clear? So what is the main focus? Main focus is promotion of health, or rather you can say in your terminology, improvement of health. But how? How we have to improve health? There is a limitation of health education. Okay. What is that? You have to change the unhealthy health behavior of the people. By changing the unhealthy health behavior, by changing the undesirable health behavior, by changing the unwanted health behavior, we have to improve or promote health. Now, in health education, we try to build or try to develop the individual capacities and improve health by changing the behavior. So, in 1980s, this concept, health education, was extensively used. What for? For changing the unhealthy health behavior. Okay. What for? For promotion of health or improvement of health. Now, just for the sake of remembrance, you should know about the definitions of, few definitions of health education. So easy. Health education is an art and science. Art means the way you are deliberating, the way you are talking with the people. And the science, what are the basis, what is the truth behind it, what are the scientific reasons. Without reasons, nobody can change their behavior, nobody can do anything without any cause. Likewise, when you will approach people, there must be some science. So, health education is an art as well as science of what? Of engaging people. You have to engage people, you have to be with the people in the process of learning. What for? For the desired health behavior. What behavior, health behavior you desire from the community for the preservation of health. Health education, WHO technical series, health education is like general education. Nothing different except adding component of health. So, health education is like general education, is concerned with what? Changes in knowledge, changes in feelings, and ultimately changes in behavior of people. In its usual form, it concentrates on developing such practices. You have developed the practices as they are believed to bring about best possible state of well-being. That is our motto. It is a process by which a group of individuals or group of other people learn to behave in a manner conducive to health, simply conducive to health. We will behave in a manner, we will behave in such a way that will be helpful to preserve our health, to promote health, to maintain health, and to restore health. Health education is the process of learning. This is most important to remember. Health education is a process of learning, aiming at encouraging people to want to be stay healthy. You have to encourage people so that people think that yes, we have to stay healthy always. Next, to know, next step, to know how to stay healthy. Want to be stay healthy? Next one, to know how to stay healthy. কিভাবে ভালোভাবে বেঁচে থাকা যায়, আমরা কিভাবে সুস্থ থাকব। আমাদের সুস্থ থাকা দরকার। ফার্স্ট ওয়ান, we have to stay healthy. How to stay healthy and what we can do individually as well as collectively. So, three things. Number one, want to be stay healthy. You have to encourage people. আমাদের উদ্বুদ্ধ করতে হবে যে আমাদেরকে সুস্থ থাকতে হবে। নেক্সট ওয়ান, কিভাবে সুস্থ থাকবো। অ্যান্ড থার্ড ওয়ান, সুস্থ থাকার জন্য আমরা কি করতে পারি ইন্ডিভিজুয়াল লেভেলে অ্যাজ ওয়েল অ্যাজ কমিটি লেভেলে আমরা কি করতে পারি কিসের জন্য, টু মেনটেন হেলথ অ্যান্ড টু সিক হেল্প when we needed. There is infrastructures, there are the other peoples, healthcare providers, the doctors. We can seek the help of them to stay healthy. Now, what is the goal of health education? Goal, the ultimate goal of health education Again the same thing, to bring about what change? Desirable change. That we desire, the change that we desire. What for? To become healthy. How? Change in behavior so as to adopt the recommended health practices by the individuals. If we follow few practices that are necessary to become healthy, that is health education, nothing but. So that's why we are telling health education is the process of increasing the capacity of the individual, capacity of the group, capacity of the community. Next, objective. Usually, there are three main objectives of health education. Goal is, what is the goal? To bring about a desirable change. In order to bring about a desirable change, what we have to do? Or other, I can say it other way, what people should do? Change their behavior. In order to change the behavior, they should know. That means they should have the clear knowledge. Then knowledge will be there. Attitude must be positive. Then they will practice these things that are recommended for healthy living. So first is informing people. You have to inform people. You have to aware people. Whenever we inform people, people will aware what is what. Previously, perhaps they did not know. When you inform them, they will know. So, health information helps people in becoming aware of their health needs as well as health problems. Next, in develop proper perceptions about them. So, what is the need once we know? Then why it arises? What does it mean? And next, seeking appropriate solutions for them. Then only people will seek solutions, people will think for solving their problem. First they should know, number one, yes, it is our problem. Many people do not know. Say for example, suppose child or adult also suffering from malnutrition. Okay, instead of having the balanced diet, they are suffering from malnutrition. They are walking barefooted here and there without using chappals. So what will happen? Automatically the hookworm will penetrate to the foot. Okay, then there will be these hookworms will be in the intestine. They will suck blood. Automatically people become malnourished. That means they do not know, number one, about the health problems. Number one. Number two, if they do not know, they will not do anything else. So we have to make them understand about this importance. The problem is there and how the problems or why the problems is being arisen, and then question comes, how to solve the problems. Next one is motivating people. Mere providing information is not sufficient, is it? You have to motivate them. Many people know many more things, but they do not practice it because they do not feel the importance, because they are not motivated enough. So next objective of health education is, first is informing people. You have to inform first, make them aware. Then among them, few people, okay, they are motivated. They will ready or they are ready to practice. But many people may not be motivated. The next step is motivate. That is the next objective of health education. Mere information is not sufficient. After information, it is also necessary to motivate them. What for? To adopt a certain desirable behavior which are conducive to health. And third one is guiding into actions. They are motivated enough, but they do not know where to go to seek advice or to seek help for solving their problem. Then you have to guide them. What to say, for example, mother did not know about the importance of vaccinations, especially about the new emerging diseases. Okay, mother did not know. So you have to inform first. Now they know that yes, vaccine is necessary to prevent different killer diseases. They know. But other family members, you have informed the mother of under 5 children. But there are other members in the family. Say for example, the mother-in-law told, chhod do, health worker will come, or the doctors, what the doctors tell, everything we may not listen, we may not follow, because you see, it is your husband's. I did not vaccinate him, but he is not suffering from any disease. So what is the need of bringing your children to inoculate or administer vaccinations? So in spite of having the knowledge, previously he was motivated, he was ready, but due to the other factors, now she became demotivated. Now again you have to go, then motivate them. To whom? Mother along with all the family members. Okay, up to that it's okay. Then they did not know when or which day we can get vaccinations of the children. So you have to guide them. There are special days. Forget about the tertiary care centers. I am telling about the secondary or primary. In that case, every day, the vaccination program may not organize. There are specific days, usually on Wednesday, and sometimes second Wednesday and Friday. And there is a timing also, so you have to guide them. These are the place, the health and wellness centers. You should go there. It is open from, say for example, 10 to 12 p.m. or 10 to 2 p.m. Specific days is Monday. So you have to bring your child, Wednesday, you have to bring your child on Wednesday for specific vaccinations. Okay. Next you see what I told, these are theoretical. Now come to the practical. Health education in action. Health education involves efforts to change behavior. Is it? Right from the beginning I am telling that objective is to change the behavior which are not desirable, to change the behavior. Examples is just open defecations, hand washing. 3 examples I have set. Open defecations, hand washing, breastfeeding. If you go back 20 years or 30 years or 40 years, due to the continuous effort, people are using sanitary latrine. Is it? Hardly you can find open defecation. Yes, still it is there in our country. It varies from state to state, even district to district. But due to the health educations, the efforts, continuous efforts of health education information, including motivations, along with helping people to establish, rather to construct sanitary latrine by providing sometimes subsidy, by providing full cost, except these places latrine construction was there for the disease. This open defecations is now being eliminated. Okay. Now we are telling about ODF. Since 2015, Government of India started the WASH program. Okay, ODF, open defecation free. Likewise, hand washing. Again, before 20-30 years, we have done so many things for practicing hand washing. This is health education, practice of health education. Nowadays, maximum people, even in the villages, you do not find that people eat food, consume food, swallow food without washing their hands, even with soap and water. Practice that has been changed. This is the effort of health education. And third one is just examples. Third one is breastfeeding. Okay. If you study the history, it is found that yes, practice of breastfeeding was there. It is being prevailed from generation to generation. But few things they did not know about the initiation of breastfeeding, about these harmful effects of prelactal feeding. Perhaps your idea about this initiation of breastfeeding means when the breastfeeding should start. Prelactal feeding? No? Yes, prelactal feeding? Any idea? No. Prelactal feeding means providing liquid before starting breastfeeding. Say for example, honey, mixed jol, double jol, whatever may be. Okay, this is prelactal feeding. It has been now discarded. Then question comes about initiation of breastfeeding. Now we are telling as quick as possible, start or initiate breastfeeding after delivery. Preferably within 1 hour or half an hour. Now it has become practiced. And next is about the continuation of breastfeeding. Okay, people continued breastfeeding, but you see there is a lacking in exclusive breastfeeding. That means the concept is being changed. Before 30 years, we told that yes, up to 3 months, only breastfeeding without a sip of water. Now we are telling up to 6 months, because baby, small kid do not require anything except breastfeeding, mother's milk. The concept is being changed because of only health education. Next is lifestyle modifications. Since the last 20 or 30 years, the percentage of people suffered by non-communicable diseases being rising day by day. So, health education has a role to modify the unhealthy behavior, or rather I can say reduce the risk factors. Perhaps all of you know about the behavioral risk factors, means modifiable risk factors of NCDs, that is use of tobacco, use of alcohol, lack of physical exercise and lack of proper diet. So there is a great role of health educations only. If you provide educations through informations, through modifications, then only people can think about modify their behavior as far as these 4 risk factors are concerned. One is unhealthy diet, lack of physical activity, use of tobacco, use of alcohol, and at the same time, the most important risk factor is the stress. The stress. So, if you can provide information, if you can motivate people, if you guide them how to do it, say for example, people started already, or rather I can say addicted to alcohol, addicted in smoking, then you have to counsel them. If it is not working, then Again, next step is you have to send them to the drug de-addiction center, or before that, suggestion counseling sessions you can arrange, then only they can be able to modify or change their lifestyles. Even people like young generation specifically go to the bed late night, woke up from the bed at 12 o'clock or 11 o'clock. That is again, this habit is not desirable for health. So it has to be changed. So this is the health education that can be able to change the behavior by increasing the capacity, or rather I can say developing, or what I should improving the self-realization capacity of the individual. And next is health educations also encourage utilization of available health services. Health services are available, may not be plenty, but yes, may not be up to the mark. So question marks is there. I am not discussing about that, but yes, health services are available. So people should go there, avail the services free of costs, then they can become healthy. What is this? Changing of behavior. Previously they did not attend, they did not receive the services. Now if they go and receive the services or avail the opportunities, then they will become healthy. Say for examples like immunization programs will be are there, distribution of iron and folic acid tablets are there, periodic health checkup is there, special clinics are there nowadays for prevention and control of NCDs, non-communicable diseases. And again, health educations encourage participations that is required in preventive services like screening test. What for? Screening, that is for cervical cancers, for breast cancers. Perhaps you know that if you can detect in early stage cervical cancers or breast cancers, then এগুলো সেরে যাবে. Okay. Now, while practicing health educations, while informing people, while motivating people, while guiding them to take actions by bringing about change in their behavior, you have to keep few basic things, rather basic principles while talking with the people, while working with the people, if you want to become successful. Number one principle is health education is primarily education. It is like general education, nothing but. In general education, we employ different materials. Now we are using LCD projectors. I am using this lecture as a method of education. Likewise, in general education, you can teach health education, you can motivate people by providing lectures, or rather I can say you can aware people by delivering lectures, or I should not say lecture, delivering speech, organizing group discussions, organizing seminars, symposiums, organizing colloquy, meeting with the villagers, meeting with the community peoples, then it will be possible to motivate them. But few principles you have to keep in mind. Number two is health education should involve free discussions. That means you have to give opportunity to the participant or to the audience to ask questions. You have to create that environment so that people will feel free to ask questions for their clarifications. This is always, must be always free discussions, or rather two-way, not like didactic lecture. I will tell you, you will listen, I will go away without giving any scope to you people to ask me for your clarification. No. Health education is always free discussions. Tell only what is needed. That is again most important. What I know, it is immaterial. But what I should tell, that is very important. According to the need of the participants, you have to tell only. Healthcare providers, the doctor should clearly understand the health needs and health problems of the people. You have to go to the people, or when the people will come to you as a doctor, when a patient will come to you, first you have to know what is exactly his or her problem. On the basis of his or her problem, that means you have to take the clear, correct, relevant case history of the patients. If it is wrong, your diagnosis will be wrong. Likewise, same thing, no difference. In clinics, we will also provide health education. First, you should know it from the patients, what is his or her problem. Sometimes they may not be able to tell. Okay, they are moving around their problems, but you have to collect correct, relevant, accurate informations. Otherwise, diagnosis will be wrong. If diagnosis is wrong, treatment protocol will be wrong. People will not come again to you. Same thing, clearly understand the health problems. Then, possible solutions. Through treatment, you are trying to solve. Here also, possible solutions. But at the same time, while prescribing the medicines or after prescribing the medicines, you have to know about the educational level or the culture as such of the patients. Even their economic conditions you have to know. Their education status you have to know. Then only you have to prescribe. And again, you have to describe what is this medicine, how it can act, and in what time you have to swallow these medicines. Here also the same things. You have to know about the level of knowledge and general education of the patients, of the people. And next, do not give conflicting information. So many a time, we unknowingly tell them. Say for example, if I tell the mothers may be educated, may not be educated, may be from urban area, peri-urban or rural area. If I tell the mother, continue breastfeeding up to 6 months, is it the correct information? 6 months. You can understand. But if I tell the mother, continue breastfeeding or exclusive breastfeeding, I am not telling. I am using this word, practice exclusive breastfeeding up to 6 months. 6 মাস পর্যন্ত এক্সক্লুসিভ ব্রেস্টফিডিং প্র্যাকটিস করবেন। ছেড়ে দিলাম, সে কি করলো, ঘাটটা নাড়িয়ে দিল। ডক্টর কি বুঝলো? উনি হয়তো বুঝে গেছে, কিন্তু উনি বোঝেননি। কি বুঝেছেন? এক্সক্লুসিভ মানে হয়তো বুঝতে পারেনি। আরে জল একটু দেবে সঙ্গে, কি হয়েছে, দুপুরে জলও দিয়ে দিল, বুকের দুধ দিল, মুখটা ধুয়ে দিল, তো দুপুরে জল 4 ফোঁটা জল খাই দিল। ডাক্তার জল খেতে মানা করেনি, খাওয়াতে মানা করেনি, উনি বলেছেন এক্সক্লুসিভ ব্রেস্টফিডিং, আমি জানি দিস ইজ এক্সক্লুসিভ ব্রেস্টফিডিং, দিস ইজ রং। তারপর এই কনফ্লিক্টিং ইনফরমেশন, what he told up to 6 months. 6 months means what? In the villages till today. Say for example, if I ask you what is your age, you can say 24 years or 20 years 3 months. But in the villages till today, they will tell 20 পেরিয়ে 21 পা দিয়েছে, 20 ক্রস করে 21 পা দিয়েছে। That means age is 21 years. That is the conflicting information. Likewise in the breastfeeding also, it's 6 months. 6 months means 5 months 30 days. That is 6 months. Mother may think 5 মাস ক্রস করে গেছে, 6 মাসে পা দিয়েছে, 6 মাস হয়ে গেল বাচ্চার বয়স, 5 মাস ক্রস করে 1 দিন বা 2 দিন হয়ে গেল, 6 মাস হয়ে গেছে, এবার সে কি করতে লাগলো, অন্য খাবার দিতে লাগলো। So that is the conflicting information. Again, different healthcare providers are there. ASHA, Anganwadi worker, health worker, health supervisor, public health nurse, medical officers, so many healthcare providers are engaged. Different healthcare providers should not give contracting messages regarding a particular problem. Okay. Next principle is interest and participations. Whatever you tell, whenever you tell, what you will tell, that depends upon the interest of the community people or the patients. Is it? That means if they are not interested one, suppose I am delivering this speech or lecture to you. If you are not interested, you are looking to your mobile. Somebody is reading some subjects. So what is the utility of my deliberations? So that is my failure also. Because you see, I did not, or rather I was not able to create that atmosphere, that environment in the class, so that you will listen what I will tell or I am telling. Likewise, if they are not interested, so they will not listen. If they listen, passive listeners, এখানে ঢুকবে, ওখানে বেরিয়ে যাবে. So, health education should relate to the interests and the felt needs of the people. There are two types of needs. One is felt needs or perceived needs. Another is actual needs or real needs. So, for example, in the next class, for example, I am telling, in the next class, there is your exam, internal exam, next class, supposing that. So, I am telling so many things and you are reading, you are preparing yourself for the next class, is it? So, that is your felt needs. What is your felt needs? Next class, you have to appear the exam. That is most important for you people, okay? But I am telling so many things. Few people may hit, attentive, others not. So, you have to know the interest of the people, or interest of the people means the needs of the people, felt needs. আসল সমস্যা কি সেটার জন্য মানুষ কিন্তু চিন্তা করে ফিউচার কি প্রবলেম হবে, people do not bother that much. Okay. Next is health educator, or rather I should say doctors should make himself acceptable. What is that? The meaning of that? You must be sympathetic. You must be friendly. Okay. You have to go down to the level of the community, then start talking. If you use scientific words like exclusive breastfeeding, আমি যদি ওটা না বলে বলতাম কেবলমাত্র বুকের দুধ, এক ফোঁটা জলও না, তাহলে মা কিন্তু বুঝতে পারতো। ওকে, সো ইউ হ্যাভ টু মেক yourself acceptable in the community or the patients. পেশেন্ট তোমার কাছে এলো, তোমার এমন বিহেভিয়ার, খারাপ বিহেভিয়ার বলছি না, তুমি এমন বিহেভ করছো, ও ভয়ে সন্ত্রস্ত, ও নিজের যে প্রবলেম ভয়ে বলতেই পারলো না। সেই জন্য কি করতে হবে? হেলথ এডুকেটর ডক্টর শুড মেক হিমসেলফ acceptable to the patients, to the community. Reinforcement. Another is reinforcement means we call it on the message. The important things you have to repeat once again. Repetitions. Reinforcement, hammering. বারবার এক কথা বলবো আমি, যেটা important, twice or thrice I will tell, then this will inculcate in the minds of the patients of the community. That is called reinforcement. That you have to keep in your mind while motivating, while informing people about adopting healthy practices. Learning by doing. Next one is learning by doing. There is a Chinese proverb. If we hear, we can forget. If we see, we can remember. If we do, we can learn. So, you have to do that. That means, say for example, I told you about the hand washing. So, you have to practice it. You have to show it. You have to demonstrate it. That is called learning by doing. Then people will learn. Health education should be need-based. No need to repeat. If there is need of the people, then only they will listen, they will practice. So, for example, everybody is practicing this. Everybody is defecating or using Santiniketan. First it works. Everybody, perhaps everybody is using Santiniketan. Yes, yes. Even small kids, when they defecate, what do you do? How do you dispose the excreta of the small child? They told, yes, within the Santiniketan, we dispose it. But after that, again you are starting about the importance of Santiniketan, why you should use Santiniketan, So this is bogus. People will not listen. So for that reasons, health education should be need-based. If you know everybody is practicing, so what is the necessity of telling them once again? Rather, you should switch over to other topics for discussions. Free flow of communication. That is again important. Communications will be free. That means when there will be free flow of communications, you have the enough knowledge. Number one, on the basis of which you can talk. Number two, confidence. That is again important. If you are confident enough, then you can tell freely without any hesitations. That is important. And next one is use audiovisual aids. I am using audiovisual aids. What for? At least two sensory organs are involved. One is ear, you are listening, and through eye you are visualizing. And last one is feedback. I told you when I start, for clarifications, you must interact with me. If you cannot understand, I will clarify. So once again, when you will talk to the people, when you will deal with the patients, the community also, once your talking is over, then you have to seek feedback, response from the audience or respondents. Then only you will be sure whether what you told they understood or not. If they could not understand, again you will repeat the same things. আমি এই জায়গাটা বুঝতে পারিনি, আমার আরেকবার বলবেন. So that is okay. Next, how we can implement health education interventions. I told you since 1980s, health education intervention was one of the most important cost-effective interventions for changing the behavior of the people, for improvement of their health. But how we can do it? Number one, this requires public health laws. আমরা বলছি legal age at marriage. It's legal age at marriage. In case of female, till now 18 years. For male, 21 years. Okay. As there is a law, there is required a law. Domestic violence, there is a law. PCPNDT Act, there is a law. MTP Act, there is a law regarding health. Suppression Immoral Law Traffic Act, there is a law. So once there is a law, then people will, simple example, forget about that, use of helmets. There is a law, use of helmets. কখনো কখনো আমরা কি করি, ভয়ে হেলমেট পরি, কখনো কখনো আমরা সেফটির জন্য পড়ি। কেউ সেফটির জন্য পড়ে, কেউ বদর করে না, আমার ল আছে কি না আছে, কেউ কিন্তু দেখে ও পুলিশ ধরবে 3000 টাকা ফাইন, তো আমি হেলমেট পরবো। সো পাবলিক হেলথ লজ ইজ ইম্পর্টেন্ট টু ইমপ্লিমেন্ট হেলথ এডুকেশন প্রোগ্রাম, প্রোভিশন অফ হেলথ সার্ভিসেস। আমি মুখে বলছি, প্লিজ ব্রিং ইউর চাইল্ড টু দি ইমিউনাইজেশন ক্লিনিক ফর ইমিউনাইজিং ইউর চিলড্রেন, বাট দেয়ার মাস্ট বি সার্ভিসেস। ওয়ান্স the people will return without having the service, never they will go. Bogus thing আমরা যাব না, ফিরে আসতে হয়েছে। And third one is community. Previously we told it community participation. Now we are changing the terminology, community engagement. You have to engage the community with any sort of program. Then only your program will be successful. And there must be intersectoral coordinations. Perhaps health does not depend upon the health sectors. Improvement of health depends upon other sectors like agriculture, like industry, like transport, like housing, like education. So there must be intersectoral coordination. Then approaches of health education. In case of complicated cases, say for example, when you will be in the clinic, usually deal with one patient at a time, individual approach. Then group approach, when we deal with a group approach. When we deal with the community, large community, then mass approach. There are different methods of health education. Listen, the methods of health education and health promotions are the same. Even methods of education, no different. These are the educational methods. All educational methods to educate the people, general education. These are the methods. What are those? Counseling, group meeting, role play, parent discussions, colloquy, symposium, seminar, workshop, exhibitions, mass meeting, and puppet show. These are the methods we use. Okay, and media, I mean TV, internet, these are the methods. Mobile application, social media, Facebook, WhatsApp, radio. Then materials we use: posters, pamphlet, leaflet, flashcards, flipbook, hoarding, folder, stickers. These are the material. About the posters, you see, everybody knows the posters. Poster jano to sabai tomra. Posters of enabling people. Uses of enabling people to gain or increase control over and to improve health. Control of what? Control of determinants of health. Perhaps you know what are the determinants of health? Already it is over. Somebody has discussed with you what are the determinants of health. That means what are the factors upon which health depends. What are the factors that influence our health? Heredity, environment, health behavior, socioeconomic conditions, what not, lifestyle. So these are the determinants. So in health promotions, we have to gain or increase control over all the determinants and improve our health. That is health promotions. There are some principles of health promotions. Empower the people. That means assist people or help people so that they can take the correct decisions. Where people take part actively. And third one is holistic. There are different determinants. So each determinant is important. Each determinant influence on health, and what are the interactions between these determinants. That is called approach is called holistic approach. And next one is equitable. Whatever may be the borlok or gorib, rich or poor, outcome must be fair. বড়লোকের ক্ষেত্রেই আউটকাম যা হবে, ট্রিটমেন্ট প্রোটোকল যা হবে, গরিবের ক্ষেত্রেও তাই হবে। ইন কেস অফ হেলথ, দ্যাট ইজ দি প্রিন্সিপলস অফ হেলথ প্রমোশনস, দ্যাট ইজ কল্ড equitable. And next one is intersectorals. In health education I told you intersectoral coordination. Here also health does not depend upon the determinants only health. Okay, health sectors, it also depends upon other sectors. There must be intersectoral coordinations. Next, sustainable. What program we will undertake that must be sustained in the long run. আজকে করলাম কালকে শেষ হয়ে গেল, no, in the long run. Okay, and last one is multi strategy. Different strategies will be there, different programs will be there, different types of policy will be there. Okay, action area, there are 5 action area of health promotions. Number 1, build healthy public policy. Without public policy nothing can be done, nothing can be sustained rather. Nobody, people will tell your or give your or take your receive your advice, others not. Next one, environment must be supportive. Here is the environment. Okay, you are the community people. Environment is supportive. Say for example, not too much hot, not too much cold, no noise, supportive environment. And third one is community, strengthen community actions, involve the community, empower the community. Community will come forward, community will demand their needs about health. Then government will have to provide these services for inculcating their needs. Develop personal skills also. You have to develop your personal skills and reorient health services. Okay, and last one is action plan. Next class, not in the next class, the next year I will discuss in details about the action plan for health promotion programs. Okay, thank you very much.